Okay, my name is Joshua. Lizzie and I met in Gunsan in South Korea, like 8 years ago now? 7, 8, something like that.
Like that, yeah.
Yeah, it was a while ago.
And I'm Shelly, married to this one. I also met him in Korea, but I actually have never met Lizzie in person. I am South African, Josh is American, and we live in South Africa together.
Yeah, in Johannesburg.
In Johannesburg, which is the main city. So we have a very, very active health care system for TB and AIDS. What active means does not mean it's comprehensive. It doesn't mean that it's very reactive, and there's a lot of research and there's a lot of community development, especially in the poorer areas, with TB, which is a respiratory disease that is passed on, very much the same as any other virus, and is also deadly, especially exactly the same as coronavirus. So people weren't worried, because we're Africans.
That is one of the things that I heard since then too, is like, oh well, African people are probably just more resilient because the water is dirty.
It's not dirty.
There's a lot of diseases. Like the water that most people drink is very clean here.
It's not dirty in any stretch of the imagination. Out of the cities, in the rural areas where they don't have access to running water and electricity, that everyone was worried about.
We were completely locked down now, so you can go out for groceries, medical care, and if you're an essential service worker.
That means that you are in food production, you're making medical equipment, or you're working in a pharmacy, dispensary, grocery store, packaging, hospitals, those kinds of things. That's it.
Utilities.
So at the start they didn't have any kind of deliveries. Like you literally couldn't get, pharmacy wouldn't deliver. There's no restaurants open, zero. Yeah. No takeaways, no food deliveries, no alcohol.
And cigarettes.
Or cigarettes whatsoever are being sold. That's causing good things and bad things at the same time. There's a lot of poverty in different areas, in urban as well as rural, and as everyone knows, in kind of poverty-stricken areas there's a higher percentage of alcoholism and drug abuse. And the alcoholism, because they can't get access to alcohol, there's less incidents of domestic violence, etc., etc. On the other hand, there have been a couple of instances of looting of liquor stores. There was an export going out in Cape Town of wine, and the truck had broken down on the road, hijacked all the wine on the truck.
Wow.
Yeah. So those kinds of things are happening. So we've actually got a decreased death rate at the moment in South Africa. Yeah. We're not having as many murders. There is an increase in domestic violence.
Mm.
But it's not tied to alcohol.
It is. I mean, always. There's always a correlation between those two, but it's not as bad because people are not buying or if they haven't stocked up.
Yeah.
They don't have it.
Yeah.
Before the lockdown, it was like 100 people, but now it's limited to 50 people. So if you go
for funerals,
that's 50 people. You can only go to a funeral, and you have to get a permit as well. So there was, in Port Elizabeth, there was a huge logjam from people coming from the outskirts to get into PE because there was a funeral, and the police and the army had cordoned off the road between the pretty much the big municipalities, and they were checking people's permits to come, and they actually just turned people back. Like they had permits to travel and all the rest, but there were just too many people, and they were like, no. What is that?
But things actually shut down. They announced on the 15th of March that schools would close and that large gatherings would be suspended. And that was
over 100 people.
Yeah, over 100 people. That went into effect on the 18th. So they shut all of the schools in the country. We had no deaths at that point. We had 61 cases.
But that was just schools. Oh,
well, at that point, all of our cases were also like Italian, an American at that point. I think we had a couple of Spain and some
Coming
Germans.
from.
People coming from there.
They hadn't found local transmissions yet, but they weren't testing widely enough.
Hmm.
And then
it was people who lived with the people who had been abroad or were also abroad and hadn't tested positive yet.
2030 announced a shutdown for midnight on the Thursday. So 23rd is a Monday, midnight on a Thursday.
27th of March.
And then you really can't go anywhere. There are cops on the road, the army's out. There's private security that rolls around in most of the suburbs. They're really on the hunt for anyone they're not going to stop you for the lockdown, put it like that.
Yes, that's not something they do.
All the highways are shut down. There's roadblocks on all of them. You've got to have paperwork if you're going to go anywhere. People have been arrested and charged. Everything's locked down. You cannot leave the country. The borders are shut. You are not welcome. No one is coming in. No land crossings on any of the African borders. There's only
repatriation flights.
Repatriation flights
trade.
To and from, and there's trade. That's it. All the churches, everything, like no one's fighting. There was a wedding. A South African couple tried to get married down in Durban.
Yep.
And the couple and the pastor and their 50 guests were all arrested and charged. Wow. And there's video of the groom helping his lovely bride into the back of a police car in her wedding dress. So a state of disaster obviously expands the powers of the government and we do have a constitution. It doesn't really do away with the constitution, it kind of suspends how they operate. So if my constitutional right to assembly and freedom of movement has been infringed by this, tough. There's nothing I can really do. The government has extended powers to arrest and search and to detain anyone that they think is either has the virus or anyone that's actually spreading false or fake news as well. There have been a couple of arrests for that.
Mm-hmm.
Some very misinformed people have been putting out fake videos about how the government has been testing with coronavirus swabs.
Like the swabs are infected.
The swabs are infected. And this guy was arrested and they've been charged. There was a minister of telecommunications that went to a friend's house and took a photo.
Put it up on the internet.
Put it up on their Twitter or Instagram, whatever it was. And they were called before the president and suspended.
Forced to apologize.
And forced to apologize on TV, and they're also being investigated by the police. I'm hopeful that they get arrested. Because everyone else does. But if you tell the cops that you're going to visit your gran or your boyfriend or anyone, they will arrest you, or they'll tell you to go home. You kind of got a 50-50 chance.
Yeah, we think people are still ignoring it though. Like our landlord and landlady told us that they've heard of people planning to go and meet for Passover celebrations.
She actually works for an ambulance service. She's like, she's not doing it, but she knows people that are doing it, and it's people are still discussing if it's a good idea, and they know it's a bad idea, but they're still going to do it.
When they actually announced the lockdown, there were 1,170 cases. And they just had, I think, 2 deaths at that point.
Yeah.
We extended the lockdown because it was supposed to just be 3 weeks. And they extended another 2 weeks on the 9th.
So after 2 weeks of the lockdown, they extended it for another 2 weeks. So we're going to have
5 at least.
We're going to have at least 5. And at the moment, we're in week number 3.
So South Africa is very poor and has a lot of economic issues. And while they're trying to do some things to alleviate, especially for the really poor people and the homeless during this, they've got shelters and things like that. There are a lot of people who live on the cusp of starvation. So they're going to have to do something to really try to remedy that if they do extend it further. And I don't know.
And there's no real money for it.
There's no money. So.
The government is running pretty badly. Previous administrations were fiscally irresponsible.
Yes.
So at the moment, everyone is really happy with the government and how they're doing it. They're very positive. They're very supportive of President Ramaphosa and the health minister. People are like, we do understand that, you know, we are in South Africa. We're not in the UK. We're not in America. We're not in South Korea, where we have a large, very well developed medical system. So that was the reason for the lockdown initially, was because while Josh and I and other people that are, you know, middle class, will have no problems accessing medical services. We don't have any of the underlying issues really that other people have. But for the large majority of the population, you've got TB, you've got AIDS, you've got poverty, and you've got malnutrition. So that's why they shut it down. We have an unemployment insurance fund, which is, so it covers people that pay on their salaries or from their income a portion of that to a fund, a government fund, for instances of maternity leave, paternity leave, retrenchment, pandemics. But the biggest problem is a large percentage of the population isn't registered. They either work for themselves, they're informal traders, they're not registered, they don't pay towards that fund. So that fund is being used, which is what it should be for. But that fund is just for, it doesn't cover your entire salary. For instance, it's only up to, I didn't even look at the threshold, but there's a threshold you can get per month for that. What's happening in terms of labor law is you take paid leave. So NAS companies are like giving, so you normally get 15 days paid leave by law. So you'll get that in advance. If you don't have those paid leave, then you're going to get unpaid leave. And some companies are actually paying out like portions, and so like your CEO will take a 30% pay cut, then the managers will take a 15%, and then if you're earning above this you'll take a 5%, just so that everyone can still be paid. But I don't think that's happening for the large percentage of the population. They can't afford to do that. That's only if you're working for a large company. South African banks are not doing their part as far as I'm concerned. The most they're doing is they've contributed towards like a solidarity fund, which the government set up for South Africans to help the government pay for pandemic supplies. So it's ventilators, medical equipment, gloves, sanitizers, all the rest. The banks have helped up with that. The CEO has taken a 30% cut. Woohoo!
Yeah.
And you don't have to pay, most of the banks have said that you don't have to pay any of your loans and that kind of thing. You won't get penalized, but don't worry, you still have to pay the interest.
Even if
that's also
they need...
That's only on people that have mortgages or on credit card loans. What happens to people that are living hand to mouth that can't even afford to get those? Yeah. And that's most of the population. We do have social grants.
And so it's the first week of the month that those come out?
Yeah, the first week of the month.
So they relaxed travel restrictions and like when the private taxis could run and things like that.
Transport.
Private transport. So that people could go and collect their social grants and then go and buy groceries and things like that. But in the couple times we've been out to drive out for groceries, we've only gone far once looking. But you still see some of the people who beg at the traffic lights. They have been going around trying to find people. Like there are some people who sleep rough in the park a quarter block away from us, and they're not there anymore. As far as I can tell, I haven't seen anyone in that area. So I think they've either been picked up or they've willingly gone to one of the shelters. But I don't know what they do with them during the day because those folks are used to being able to do anything they want to.
So getting them to stay is hard.
Yeah.
We haven't had too much transmission within the really poor and
like in the townships.
In the townships, there have been a couple of isolated cases,
Salem Township is.
in the townships.
Do you think that that's accurate, or do you think it's being underreported?
We know, everyone knows it's being underreported, even the president and the health minister. That's one of the reasons that they extended the lockdown.
The testing there hasn't been enough testing, right?
Yeah.
So like right now there are 2,100 some odd cases and 25 people have died, but we know there's more than that. But the rolling out of testing, it just hasn't increased as quickly as it needs to.
Like, say you suspected today that you have coronavirus, what would you do?
You'll have to call the National Institute of Communicable Diseases, blah, blah, and you'll tell them what your symptoms are, and they'll tell you if they're going to send someone out. The number is being advertised on electronic boards, on the radio, on the internet. All South African websites, because of the state of disaster, they've expanded like requirements, and one of the requirements is that all South African
like if you can view the website in
If you
South
can-
Africa,
yes.
there's supposed to be a thing
at the top on your
That's fine.
homepage to say, hey, listen, if you're looking for information on coronavirus, or if you suspect it, please contact or like look at this link, and it'll send you to the NICD. So what they'll do is they'll literally send someone to you. And if they then think, so then they'll test you for they'll test you for the temperature and see if you have any other indicators. But if they don't think you have it, then they're not going to test you because they just don't have the capacity. You can go and get tested privately yourself. It's 850 Rand to get tested. If you are positive and you have a medical aid, then your medical aid will cover it.
Yeah.
If you test it and you have a medical aid and you're not positive, then you have to pay it yourself.
And that's like £30.
Could most people afford to pay that?
In our area, yes.
Yeah, where we live, definitely. If you're middle class, yes. But if you were very poor, no.
There's
That would be crushing.
that's half your income. We don't have socialized medicine really in South Africa, but we kind of do. It's like a two-tier system, right? So there's government system, there's government hospitals, there's government clinics, there's outreach, there's NGOs, NPOs, all the rest that help with health work, and then there's the private sector, and you can go to both. And you'll kind of, it depends on like, do you want nice curtains on the windows, or do you want to wait for, 6 hours, 10 hours, 2 days to see a doctor? It's kind of, it is supported, but the level of care is not the same.
That's the big complaint that you hear is that like the government hospitals are just, they're not good enough, and there's no supplies, and people steal things, and
This is even before coronavirus.
this is before that.
So
Some of it, I think, is there are a lot of by well off I mean white South Africans.
for the most part, yes.
Yeah, who everything is bad here. Everything is terrible. It's the worst. Everything's just absolutely awful, and it's like, okay.
I must say the biggest problem with the lockdown, especially in the townships, is it's overcrowding.
Yeah.
You've got 6 people in a tiny room.
That's, I think, why the lockdown was
Put
as
in place.
early as it was and as severe as it is because those townships and informal settlements and things like that, with the incredible density of population and housing,
They don't have running water.
Yeah. It's like if coronavirus gets going in there, it will be really bad.
It'll decimate the population. The medical, all the facilities will be overrun. We know we don't have enough ventilators. We know we don't have enough anything, honestly.
I mean, Ramaphosa said that in his speech. He was like, we can't handle this if it goes wild, so we have to do it.
You live like 6 people to a room or something. Is it even possible to have an effective lockdown? Like,
Well, you certainly can't social distance.
You can't social distance.
They had reporters in talking to people, and they're asking them, like, how are you going to do this? Why are you not staying in your house? And like, there's 6 of us, and we live in like one room, so we can't.
Yeah.
We can't possibly all stay in that room all day.
The police and the army have been into some of the townships, and there've been some bad things that have happened. A couple of people have been hurt, a couple of people have been killed, but like not
I think it's not on the level that people expected.
Yes.
I believe people thought that the army especially would just shoot lots of people or something, or just beat them to death constantly, and it hasn't really been the case.
The first thing that they said was don't use masks, and now it's kind of like use masks, use something else, maybe, kind of. So it's like, it's very piecemeal, and nobody really knows what to do, and other people are freaking out, and they're wearing like silk scarves over their mouths.
There's not like that in the East Asia thing where everybody goes, oh, there's MERS or SARS or something like that. Everyone should wear a mask, and everyone knows how to wear a mask. No one really understands how to do it here unless they have extra experience. So it's all, and all under the nose.
It's all under the nose, or you
put your mask on your head when you're walking through the mall,
and then
because you only need it if you're near someone.
or you just hold it onto your face with your gloves while you're playing on your phone, and then when you want to talk to someone, you bring it down and you talk to them. Very useful.
That's not how it works.
But there's a lot of internet wisdom and a lot of people bitching at each other about, I saw this one going for a run with their dogs, and why were you walking with a pram? I saw you with your cup of coffee. It's a tale of two cities, two countries.
Yeah.
Kind of situation, which is very sad.
Vast differences between how the very poor and the mid to upper class live.
After this is all over, do you anticipate there being any permanent changes?
Well, your parents and your sister aren't going to come and visit us.
Yeah, no, my family's not coming to visit this year.
They were supposed to come in June.
A few years, actually.
They were supposed to come in June.
But for South Africa as a whole, I think it's really going to depend. I think this is globally as well. How soon they can create a vaccine, or find some way to safely allow people to travel, so you don't have flare-ups again.
There's a large chunk of our income that comes from tourism, and that's going to be painful.
The returning South Africans have to quarantine for 14 days, mandatory.
And they get tested before they leave. So the World Cup was here in 2010, right? And the big stadium in Cape Town. Now, obviously, Cape Town's huge, tourist destination. So they think there's about 6,000 tourists still stuck in South Africa in Cape Town. So what they're doing is, if you've gotten on a repatriation flight, you have to go to one of the stadium's been set up with the airports company and the army and the health department, and what they do is, once your flight's been confirmed or whatever, you go there like 2 or 3 hours, 5 hours before your flight. You got all your paperwork. There's a video of it on they'll check your paperwork, you'll go and you'll get a medical screening, they'll take your temperature, they'll ask you about your travel history, they'll take down where you stayed, how you stayed, who you stayed with, their contact details, they'll do like an entire questionnaire, and then they'll put you in a holding area for your plane, and then you'll get on a bus, go to the airport, get on your plane and leave. And I don't think that's going to change anytime soon. So a lot of the issues that we've had, especially with money now, everyone says that it is as a result of mismanagement, government mismanagement from our previous administration. He literally just stole billions and put in his cronies. What's happening now is that's come home to roost in the sectors that have to fight corona. So there are people that are in management that are supposed to come up with plans that have no background in doing what they're supposed to be doing. But on the flip side, private companies are coming up and coming forward and saying, okay, listen, we're going to help you with this. Okay, we're going to do that. And a lot of the time, it's not for profit as well. It's not like an NGO or something. For-profit companies will say, okay, government, you're in this area, we're in this area, we can do this, let us do this for you. There's a lot of goodwill and people coming together and understanding, especially like food packages. To feed people in rural and undeveloped areas. The historical issues with communication have kind of come to the fore, and now people are like, okay, we have to fix this. So a lot of things are kind of shaking loose.
So it could be beneficial in many ways.
I think there are going to be some benefits with this, with the public and the private kind of partnership that's going to happen, that is happening. We're pretty fortunate, like I said, because we've got the history of TB and AIDS. We're kind of used to communicable diseases, even though we don't have the response that we still need, because we need the money, we need the training, you need the rollout that we don't have. So we kind of know what we don't have. Which is helpful.
And people take it seriously, I guess, because if they're used to seeing those things, they're like, okay, yeah, we know what to do.
I mean,
hopefully,
yeah.
Maybe at the government level, there are people who do. Like initially, when the lockdown happened, there were big parties and stuff that the police and the army had to break up. A block party style lockdown party. Out in the street.
Yeah, no, that's gonna be a fun thing. Honestly, the economic impact is going to be worse than the medical impact here, which we are grateful for. So, the kind of hardship that's going to come, and they say starvation, if this goes on for any longer, then that's going to outweigh any good that this, it's kind of
organizational good.
It's horrifying no matter what you do.